Dr. Suvarchalaa, Scientific Director with ZIVA Fertility Centers. Today we'll understand the importance of ultrasonography when undergoing infertility treatment. There are a number of times that we'll call you for an ultrasonography during various stages of the treatment or before treatment also. Let's try to understand what are the checkpoints for ultrasonography. To begin with, when you come for the first visit, you may be at any stage of your period, your menstrual cycle. Fertility specialists usually prefer to scan you to understand how your ovaries are, your uterus is. Now, a lot of things can be revealed in this scan. The size of the ovaries, the volume, the number of eggs that are growing at that particular time of your period, the endometrial status, which is the lining inside your uterus. If there are any abnormalities, if there are fibroids, adenoids, any endometrial scars, endometrium is not good due to endometriosis, all these things are assessed on that first visit. So it's very essential that you get it done. There are a few more things, like if there is an inability to do this scan, which is usually a transvaginal scan, it also indicates cervical stenosis, that is difficulty in passing the probe into your vagina. It could also indirectly mean that you're having difficulty in having intercourse. So these personal issues also come out in the open, and you're able to freely discuss with your doctor if you're having an issue with not just having the scan done but also having problem during intercourse. So this scan is a very essential scan. Then when we finally decide what treatment to give you, the ultrasonography plays a very important role. Whether it is ovulation induction, where tablets are given for eggs to grow, or it is follicular study where no tablets are given, but on a natural cycle, during the natural duration of your egg growth, scans are performed to see how the growth is, when it is of the right size, when it is getting released. These scans are very, very critical at this stage also. And whether it is these treatment protocols or an IUI or IVF. Now, intrauterine insemination or IUI or in vitro fertilization or IVF are a little advanced in their protocols when it comes to treatment. These require constant monitoring of your egg, because when it is of the right size, sometimes the right medication to release the egg is given, especially during IUI, and in IVF, the right medication to mature the egg is given so that the eggs can be retrieved and embryos can be formed in the laboratory. So during treatment, ultrasonography is very critical. Not just the growth of eggs, the number of eggs that are growing, the way the ovaries are behaving, because if you're overstimulating, then you get into something called as ovarian hyperstimulation. Or the first way of assessing is a scan based on your symptoms, on your blood reports and a lot more things, but a scan will confirm this issue. Not just the ovaries, the endometrium is also assessed during treatment cycles. If the endometrium is not according to the stage of development, then the procedure may also be cancelled, especially when it comes to embryo transfer during IVF. So how is it assessed? Blood flow to the endometrium can be assessed, and if it is suboptimal, then you're giving the choice of cancelling the cycle. So these are things that are performed during treatment. Now, after pregnancy also ultrasounds are done throughout, but as a fertility clinic, what your center will do is call you to see if sacs have been formed, the embryo is implanted, if the heartbeat has come, if it is performing well, and if it is growing according to stage, then neural tube scans etc. are performed. Those are pregnancy scans. So initial stages of pregnancy also can be assessed soon after pregnancy, after fertility treatment. So it's a play between not just medications but also constant surveillance of your ovaries and endometrium, which will then give you better success rate. If you understand more about treatment options for fertility, please feel free to contact us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.